Hi, so my name is Dr. Tsay. I'm Medical Director of Ageless MD. We're based out of Orange County, California. So I actually use all of BENEV's products. I use we call it the trifecta. They have the MiraQ PDO threads. They actually have the Silfirm X, which is the RF radio frequency microneedling, and they have their BENEV exosomes, which you apply topically for post-care recovery. So I use a combination of all three, which they actually enhance. MiraQ threads, they partner directly with the manufacturer Dongbang in South Korea. And so you're not getting a repackaged product that someone just slapped their label on. You're actually getting the direct product from South Korea. So it has a longer shelf life, and just the threads themselves are very robust. They're very heavy molded threads. They're molded barbs. And so they do a lot of lifting, very, very strong tensile strength, and really one of the strongest threads on the market. So here we're looking at a before and after photo of a PDO thread lift, and you can see the effects of the thread lift in several areas. One, if you look at her nasolabial fold, her mid-face is lifted. She looks like she even have a little bit of cheek fillers because the threads are actually repositioning her fat pads into a higher position. And finally, threads are the strongest for the lower face. So unlike fillers and Botox, which is great for the mid and upper face, the threads really help like some jowling, skin laxity, any sort of drooping or effects of gravity you have on the lower face, and it lifts that up. It's almost like a little mini facelift, but for someone who's not ready for a facelift. So this is I think it's one of the best examples of a thread lift, and for the right demographic. It's someone who's, still fairly young, maybe in the 30s or 40s, and has some effects of gravity. They're already experiencing some drooping, some sagging, but not too severe. It's mild to moderate. This is a perfect demographic where the thread lifts can be really enhance and improve the lower face, the jowls, without doing any sort of any surgical intervention. So one of the things that I really want to relay to my patients is that I truly care. They're the most important person in the world when they're sitting in that chair, and I want to make sure that they have the complete trust in me, and I will take the best care of them, and really making sure my skills are honed in to give them the very best results possible.